Good morning, all. Myself, Dr. Amreen Sultana here, Assistant Professor of Pharmacy Practice Department from MLR College of Pharmacy. Today, I'm here to discuss about the topic of pharmacogenetics. So let us start with a small example. What is pharmacogenetics? So, so now in this case, we are discussing a small example to understand what is pharmacogenetics here. Okay. So we are taking here the three male patients that name as Tom, Jake, and the Harry. Okay. So after taking the three patients here, all these three patients are suffering from the same disease. Let us consider about the hypertension disease. Okay. Now after giving the hypertension, for the hypertension, the drug A is given. After giving the same drug is given for the three patient as well. Drug A is given with the same drug, with the same dose, and with the same regimen is given. Okay. Now, after giving the same treatment also, the results are totally different here from each other. Now, let us discuss what is Tom's case. In Tom's, see, you can see Tom is very much sad here because he had not been treated with the hypertension correctly. At the end, he got the increased level of the hypertension. That is nothing but increased level of the blood pressure. That condition is known as hypertension. Okay. In case of Dick, you can see he is very much happy because after giving the same drug to the patient, same dose is given, he got the correct result. He had been treated with the hypertension here. In case of Harry, you can see in case of Harry is very much crying here because previously he was suffering from the hypertension. Now he is suffering from the lower hypertension. That is nothing but low level of the blood pressure. That condition is known as lower hypertension. Now you can see what is the difference you need to identify. Why there is a lot of changes are there between the three patients after giving the same drug for the patient. We are giving the same drug, same dose as well, same regimen is given for the three of the patients who are suffering from the same disease, that is hypertension. You need to identify what is the difference is there between the three patients. Now, after how you can identify based on the variable response to a drug. Variable response to a drug, you can identify it. Because see, in general population also, if we are taking this variable response to a drug, it is thought to follow a normal constant distribution for about a mean or average value. That is nothing but average value here, that is ED50. So in case of Harry, you can say, see it as previously Harry was suffering from the hypertension here. Okay. Now from hypertension to he got the hypotension. Why you need to identify it. So based on the graphical representation, we can say it as this curve. It describes as the hypertension in the case of Harry. This curve, it describes as the hypertension. Now, Harry was consuming the same normal dose of the drug, but his hypertension level was getting converted to the hypotension. Hypertension to hypotension, it had been converted. Okay, it is nothing but extension of the pharmacological response. Extension of the pharmacological response of the drug. Based on that itself, Harry got the hypertension to the hypotension again. Now, in case of Tom, as we have said, Tom didn't get he didn't get correct treatment. After taking the treatment also, his hypertension level was getting increased. Why? Because Tom was a poor responder. Tom was a poor responder. Even after taking the higher dose of the drug for the hypertension, its blood pressure level was getting increased. Hypertension level was getting increased in his case. Why? Because there is a difference between the both of the patients, Harry and Tom. Differences it may be due to the individuality of the patient may be seen here. For that purpose, the results are different. So now in this case, modern genetic method. Now in the modern genetic method, it had been identified it as there is a lot of changes in the Harry's case and the Tom's case. In case of Harry, you can say what are the alterations we can see in the case of Harry. Let us consider only about Harry's case first. The first one, that is drug metabolizing enzymes. Drug metabolizing enzymes are decreasing here. Drug metabolizing enzymes is nothing but plasma concentration of the drug is getting decreases here. For that purpose, Harry got the hypertension to the hypotension again here. Now second case, that is drug risk transporters. Drug transporters, that is nothing but drug elimination of the drug here, you can say it as elimination of the drug. So elimination of the drug is also decreases here. Now third condition, that is drug receptors. In the drug receptors, it had been increased. For that purpose itself, plasma concentration of the drug is decreases, elimination of the drug is decreases, but only the drug receptors have been increases. So for that case, you can identify it as, in the Harry's case, Harry was suffering from the hypertension to the again hypotension here. Okay, now coming to the next Tom's case. In the Tom's case, the drug metabolizing enzymes are increasing. It's totally vice versa. Drug metabolizing enzymes are increasing. Drug metabolizing enzymes is nothing but plasma concentration of the drug is getting increased. Drug transporters, it is nothing but elimination of the drug is getting increased, but drug receptors, that is getting decreases in the case of Tom. Both are vice versa case. So for that purpose, based on the inter-individuality of the patient itself, based on this condition only, you can identify it as the pharmacogenetics is differs from each patient. Based on the genetic condition, it differs from the each and every other patient here. So let us start about the definition of the pharmacogenetics. Pharmacogenetics, it is nothing but it refers to the study of genetic influences on the individual's response to drugs. In pharmacogenetics, the analysis of a specific gene or group of genes. Now, in this case, particular one gene, you can take it as or it as group of genes. By taking that genes, you need to analyze this itself. It may be used to predict responses to a specific drug or class of drugs. It may be due to one drug or it may be due to many drugs also. There is a lot of difference between it is there. So next, coming to the definition of pharmacogenomics. There is a lot of difference between genetics and the genomics. Pharmacogenomics, it refers to collectively to all genes that influence drug responses and how genome-wide analyses may be used to identify such genes. In the search for novel drug targets or key determinants of drug reactions, you can say. That is nothing but in case of genomic conditions here, we are collectively taking all the genes that will be getting influences again by the drug based on the drug response. How the drug is responding, that get influences here. And based on that influence condition of the genomic itself, we need to analyze it, whether it will, we need to identify it for this target drugs, not novel drug targets. That condition is known as genomics condition. So next, coming to the genetic polymorphisms. Genetic polymorphisms, historically population variability in drug metabolism or therapeutic response was described in terms of the observed phenotype. There is a lot of difference between phenotype and the genotypic condition. Okay, for example, slow metabolizers or sensitive responders. See, in this case, you need to just observe about the therapeutic response. What is the therapeutic response of the drug is there? In the form of phenotypic conditions here. Phenotypic condition is nothing but what just we need to observe that condition, what we observed. Again, this phenotypic condition will be getting divided into the population depending upon the phenotypic condition here. Slow responders, slow metabolizers, it is there. Slow metabolizers, it is nothing but group of people who does not respond to a normal dose of a drug. That condition is known as slow metabolizers. There is a lot of difference between phenotypic conditions, slow metabolizers, and sensitive responders. Sensitive responders is nothing but group of people who respond to higher doses of the drug. That condition is known as sensitive responders. Slow metabolizers is quietly opposite to the sensitive responders. Okay. With our alterations or with our understanding of genetics, we are often able to ascribe. Ascribe is nothing but cause. We need to identify the cause. What is the cause for the disease have been changed? Specific alterations in gene sequence or genotypic condition to explain such observed effects. Okay, so in this you need to identify it to produce the adverse effect of a normal dose of a drug and require a lower dose of the drug. Okay, you need to identify in this case. So let us, I'll be giving some small example and again we'll be getting back with the same slide. So in this case here, the two females, I'm taking the example for this. In this case, the two females are there. Okay, they are completely alcohol flush. Now these two patients are taking the regular alcohol. They're consuming regular alcoholic condition. Okay, they're regularly consuming the alcohol here, but we need to check the difference between before and after taking the alcoholic condition. Before, the phase was normal in the two cases itself, but here it is like a little bit alcohol flush, or you can say it as Asian flush for this. Alcohol flush, it is nothing but there is a alcohol flush is nothing but there is some changes in the uh, facial condition itself. Like you can say it as see, now in this case you can identify it. There is a fluffy face here. It may be due to arrhythmias condition, or it may be due to sometimes it may become for the complete body itself. Now in this case also you can see here the face is completely slim, but here the face is completely fluffy type it is there. Okay. So based on this condition is nothing but alcohol flush. It may be comes due to the arrhythmia condition, or it may be due to neck it comes, or it may be, sometimes it may become due to the complete body also. Even in this case, before or after you can say it as. So next coming to this. So in this case, now we'll be taking, now just we are taking the example right now. So for this alcohol, this is nothing but alcohol here. Now this alcohol, the female and the male patient, both we can need to consider it here. Okay. Now alcohol is converted to the acetaldehyde condition now. Based on how it is getting converted, be based on the ADH condition. That is nothing but alcohol dehydrogenase condition. Based on that itself, it is getting converted to the acetaldehyde. Now, this acetaldehyde is nothing but toxic substances here. This acetaldehyde is nothing but it is a toxic substance. Now, these toxic substances of acetaldehyde, it is again converted to the acetate. This acetate is nothing but non-toxic condition here. How it is getting converted to the acetate, from acetaldehyde to acetate, it is getting converted, right? How it is getting converted, you need to identify it. Based on the ADALDH2, that is nothing but aldehyde dehydrogenase 2. That based on this itself, it is be converted to the acetaldehyde to the acetate. Now this acetate is a non-toxic substance. Now, again, it had been came from the two variants. That is this one. Some normal, let us take about this. Normal one is ALDH2 star 1. That is glutamate. Abnormal is ALDH2 star 2. Here the glutamate, it is getting converted to the lysis condition again. Okay. So SNP, based on the SNP condition itself, you will be getting this result. SNP is nothing but single nucleotide polypeptide condition. SNP. Based on the SNP condition itself, we can go for it. So for example, now here we'll be taking the two examples here. Just one example will be just one parent, that is from parents. One is mom, parent, and the other one is dad. Now this mother, it is having aldehyde dehydrogenase 2 star 1 condition, and the dad father is having ALDH2 star 2. The result is different here. So that result, it comes under the heterozygous condition. Now this heterozygous condition, it develops tolerance condition here. Sometimes it may also risk, there is a lot of risk for this, increased risk of cancer here. This heterozygous is 10 times slower. The metabolizing condition will be slow here. But next example, coming to the next example, that is ALDH2 star 2. That is nothing but aldehyde dehydrogenase 2 star 2. And for further, you can say it as the same result, ALDH2 star 2. That is nothing but it comes in the homozygous condition. This homozygous condition, it is a non-fictional cases here, non-fictional. See, if you are having different genes in case of first case, different genes is there, different enzymes will be getting, and the drug will be getting different response here. It won't give correct response, different responses it gives. But in case of homozygous condition, both mother and the father's conditions are the same. Genetic condition is same. So now here there is a non-functional. The metabolizing rate will be there, but not comparatively the heterozygous condition. Okay, that there is a different genes, different with different enzymes, and the result will be different drug responses here. So next, one more example, let me give here. See, in this case, both the mother and father, the person is nothing but child. Okay. In this case, father is having ALDH2 star 1 condition, but mother is having ALDH2 star 1 condition. That is nothing but both are the same one, star 1 and star 1. It is comes under this, the children will be getting homozygous condition. And you need to identify the metabolizing condition here. Phenotypic condition, that is metabolizing, it will be there. Metabolism condition, it will be there. ALDH2 star 2, the father's condition. But coming to the parent mother here, that is ALDH2 star 2. Here we'll be getting the heterozygous condition here. Both are different. Here the father is having star 1 condition, but here the mother is having star 2 condition. That genotypic condition is nothing but heterozygous condition, it is there. But here the phenotypic condition is a metabolism condition. It observes metabolism condition. ALDH2 star 2, it is there for the father, but mother is also same, ALDH2 star 2. That condition is known as homozygous condition. But in these cases, mostly in these cases, you can see no metabolism rate condition here. Here, the metabolism condition won't be there comparatively the other one. So next, coming to this, already I have discussed this one. Polymorphisms are the distinct from the mutations that occur in less than 1% of the population. The most population occurring from the genetic variability is the single nucleotide polymorphism, that is SNP. It is also known as SNP, SNIP. SNP, it results from a change in single nucleotide base pair within the gene sequence. So next, coming to the genetic polymorphisms in drug metabolism here. How the drug is getting metabolized here in the genetic condition, it is there. See, in this case, we are having the two conditions in the metabolism conditions, the non-polar drug and the polar drug. Now, How this non-polar is getting converted to the polar, here you need to identify based on the some kind of enzymes. These enzymes is again divided into two conditions, that is phase 1 enzymes and the phase 2 enzymes, second one. In the phase 1 enzyme, that is oxidation, reduction and hydrolysis reactions, you can see oxidation, reduction and hydrolysis reactions. But in phase 2, you can say it as conjugation reactions here. Based on this itself, you can identify the metabolism condition of the genetic polymorphism here. So, genetic polymorphism in drug metabolisms. Polymorphisms have been reported in both the phases. As I've said you, both the conditions you can report it in phase 1 and the phase 2 of the drug metabolizing enzymes and can affect the pharmacokinetic profile of a drug for a given patient. Pharmacokinetic effect is nothing but absorption, distribution, metabolism and excretion. Sometimes it may be getting affected here. Understanding a patient's genetic determinants of drug metabolism and consequences of these polymorphisms could be used to design optimum personalized dosing regimens in the clinic that would avoid adverse reactions or treatment failures due to some subtherapeutic doses. Sometimes it may be give the adverse reactions also. So for this to avoid it, you need to understand it clearly the concept of this genetic polymorphism condition. So that's it for today's class. We'll be continuing this topic in the next class also. Thank you all.